Some of my biggest pet peeves as a healthcare provider kind of fall into the line of education. I'm Amy, and I'm a nurse practitioner, and I want to share with you a patient story that I come across quite often. This particular incident isn't necessarily uncommon. I see it quite a lot, but I think that it's worth sharing to get kind of an idea across as to the failures in healthcare. I came across a woman very recently, and we got to talking, and she was telling me how much she absolutely hated the injectable diabetic drug. And we're not talking insulin; we're talking about Ozempic. She said how much she absolutely hated it. Ever since she's been on it, she's been sick. She, eats something and then she feels very nauseous, and she can't eat very much, and so she just was, really bagging on this medication. And I said, "Oh, you're on it for your diabetes?" And she said, "Well, yeah, that's what my doctor said, that I should take it for diabetes, so I didn't have to take insulin." And I said, "Okay, what else did your doctor tell you?" And because really what she's suggesting to me, basically says she doesn't really know much about this medication, which is kind of all over the place. Everybody knows about semaglutide, I feel like. They come into me with wanting that medication after all the research that they've done. And she kind of said, "What do you mean?" She said it was for diabetes. And I said, "Well, it is for diabetes, but do you know what happens when you take it?" And she goes, it's for my diabetes. And I mean, that was kind of just our reverberating, comments. So then I, explained to her, it slows down gastric emptying, it, does this, it does that with your, and helps with your blood sugar. And yes, it brings down your diabetes, but you aren't going to be able to eat like you were. And that's the reason Hollywood loves this med. And she kind of looked at me and she goes, "What are you talking about? I don't want to eat less." She goes, "I just want to control my diabetes." So it was kind of a long education piece to explain to her and kind of encourage her that she didn't like the medication because of the side effects, and that wasn't what her goal was. Then she needed to go back to her primary care and have a conversation with her. And she looked at me and she goes, "Well, it doesn't work like that. I can't get an appointment for another couple months, and she just told me I had to take it." And it really kind of, I guess solidifies in my brain what, a failure in healthcare is. First, she can't get an appointment when she needs it because she needs some more education. And two, she was given a medication and was never told what it was or why she should take it and how it affects her body. Wasn't told about any side effects. And, I think that just really is, a bad example of how healthcare is these days. So I wanted to let you know, my passion is to always make sure that my patients are educated. They know what they're taking, why they're taking it. And if they choose not to take it, I can respect that. I mean, we have an honest conversation as to why this medication is important for your health. So again, my clinic is Viking Health Direct Patient Care in Henderson, Nevada. Like and follow me for more. Visit my website,